2, 1. Hey, science seekers, welcome back to a very special edition of our show. Today we have my mother, Mrs. Carol Pfeiffer. Mrs. Carol Pfeiffer is well, you know what? I'm going to let her talk about her qualifications and who she is, and then we're going to go and talk a little bit about COVID-19 and the coronavirus. Go ahead, Ms. Pfeiffer. What is your
Hi. Hi, I've been a nurse for a long time, over 40 some years. I started with a 2-year degree from Triton College, and then I went on to school with masters in DePaul and Loyola, and finally my master's at Northern. I've had experience in critical care. I've had experience in recovery room, orthopedics, telemetry. I worked all over the hospital in different areas. Then I went into quality, and now I work more with administration, with nursing and quality and patient safety in a local hospital nearby. And I'm over a lot of different areas, and actually helping fighting with the nurses of the local virus going on.
Yes. So when you talk about that, what is some of your main responsibilities in your position with what's happening right now in the hospital?
I'm there to make sure that the patients are kept safe, as well as the nursing, and make sure the nursing is trained appropriately, as well as making sure we have all the equipment and supplies for what they need, and help to distribute the staff to where they need to always care for the patients, and extend one of our missions is the healing ministry of Jesus, and we always want to try to keep both our patients and our staff safe, no matter what we are doing.
Okay. So I imagine you're quite busy these days.
Yes, it's like a never-ending job. In fact, this is one of my few days off, and I get a lot of different calls at all different times. And really the key is to keep calm, and I have a lot of great support from people within a health system, as well as administrators and everyone. So we all kind of support each other.
Okay. And since this all has happened, what kinds of things have changed around the hospital? I know you had mentioned maybe is there a new type of isolation technique, and is there, I know you mentioned things about quarantining certain rooms or certain people, and how
what it is we really try to tell people that it hasn't hit Chicago at the peak yet, but we can see busyness happening more and more. It can be where people are no longer coming to the ER for just minor things, which they should not. Also to teach people really much about the hand hygiene and how to keep themselves safe, and all of that about you never know who may be asymptomatic but could be carrying it. So you want to make sure you really keep yourself safe now that you have to stay home with the school and all of that. But when you have that distancing with people, and when people come into the hospital now, we see a lot of people that come in and think they have the flu for a while and they're good for a while. Some people do well and recover, no problem, but other people can get critically ill and very sick within a very short time and end up on ventilators. That's why you hear all the no news about people that need ventilators. And these aren't just old people. It can be young people. The old people who have a lot of comorbidities, meaning they have heart failure, high blood pressure, bad breathing, COPD, those are the people very much at risk that you want to make sure they, as hard as it is, they need to stay home. It's not the time to have everybody go to the grocery store together, or the time for a lot of people to be having gatherings. Today is Easter Sunday, and we had to make sure that, everybody kept their distance. No, we couldn't have an Easter brunch or anything.
Okay.
So happy Easter, everybody.
So again, we're going to ask you a few questions, and, just for qualifications purposes,
Okay.
my students know this, but my parents don't. So I just want to put it out there that I also have my degrees in biology, and my minor was microbiology and master's in biology. And my mother here certainly has those degrees in the medical field as well. So this is her opinion, but it's a much more professional opinion than even I could give the kids. So let's go ahead and give you a couple of the questions the students had. One of the questions the students had was, in your opinion, when do you think this is, I know you've mentioned it to me, when do you think it might peak, or can you talk about what peaking means? You've said that a few times as far as here in Illinois.
Well,
what does that mean exactly?
Yes, peaking one is when we see the majority of the cases on the new cases being reported. I was hoping it would peak around the 15th of April, but it looks more like it's going to peak closer to the end of April is what I'm hoping. And we know that when we see new cases of not coming forward, it has approximately like a 14-day incubation is what we're looking at, but people don't show symptoms right away. So that's why you have to really watch, even if you may be in contact with somebody that you don't know. And so I'm hoping and praying by the end of April, we'll see the peak.
Oh, okay. All right. So that's good to know for us. And that's different though for every state then, right? I mean, like
Yeah, it's every state. We're behind New York. New York peaked earlier than us. And they're still peaking. I think they're hoping they're going on the downtrend from that. So that's why it's more of a matter of, I try not to watch or listen to the news too much because after I work a lot of hours too, I don't want to hear too much about it anyway from that. But, you know, once in a while, just to stay on top of how things are going.
And are you in
that's where we're
contact with the CDC to tell them the number of cases in your hospital?
What happens is we have requirements that we have to turn in every day of how many new things that go to the Illinois Department of Public Health. And from there, a person who specializes in infection control person puts all the patients that have been positive in there, as well as we report the positives, and then they follow up on anybody who may have passed away and all of that. So there's a lot of documentation that they take care of. They also have to track and follow, you know, and investigate people who turn out positive.
So here's another question for one of my students. If people are staying home away from the virus, how are they developing an immunity to it for later on? Not being exposed.
We don't yet know. That's a question as far as they still have to do studies about the antibodies, and some people may develop the antibodies, some may not. So even if you're home doesn't mean that the virus isn't necessarily somewhere in your house by someone else who might have brought it in. That's why you've got the people buying the Clorox wipes and the cleaning and all of that. So right now, because it's such unknown, they don't have everything discovered about it yet. There'll be years of research after this is done.
Okay. So what are some of the preventative measures you're doing to help prevent cross-contamination in the hospital between everyone working? I mean, it's got to be close proximity, but yet keeping your distance and helping them at the same time.
Well, in the hospital, the nurses do have to, especially when we have people that are positive, we make sure the nurses have all the equipment they need, which is a gown, which is those masks that they are, you know, the N95 special mask when they're positive. They have to have a special face shield so they don't get sneezes or coughs or anything in their eyes. And they have to be very careful taking everything off and on. And then when they get out of the rooms and that, they have to wash their hands. And we make sure that people that are positive or under what's called people under investigation, or PUIs they're called, are separated. And the same nurse doesn't take care of patients who don't have any symptoms or aren't under investigation, and these other ones. So you keep the nurses separate in that. And you want to be careful to make sure, you know, you protect yourself too when you're caring for patients.
Okay, let's see. Is there any evidence, or do you know why they came up with the 6-foot distancing as far as one of the norms for, you know, respecting each other's space? They say approximately 6 feet. Is there a difference between 6 and 5? Like, is there any data or evidence?
I think that's the average that people know how much 6 is. I think it's how far your arms can reach from each other so that there's no touching. And probably, you know, this is just my theory. I don't know for sure how they got it. But, you know, if you were to sneeze or cough, that's probably the distance that a lot of it would go to, a spray. But, you know, now that we're all hopefully wearing masks in front of people, the mask will help keep your cough inside or your sneezing inside so you don't spread it.
Okay.
But,
and then one student wanted to know what can we do to boost our immunity in a short period of time? What are some measures?
Probably, I think one of the things is, again, your hand washing is key. to make sure you eat right, eat proper, as well as also get enough sleep. You can feel that when you're tired and you're worn down and exhausted, your immunity is down. And really, I'm not sure what special diets there are, but other than that, I'm not sure of any other medical terms
Sure.
that
Yeah.
they can do.
Okay.
But
All right, great. And then what does social distancing like mean in your opinion? Like since we were just talking about the whole 6-foot radius, what sort of
the social distancing is, it's a way that you truly have to, when you think of how Mayor Lightfoot closed down the beaches and the walkways on Lakeshore Drive, the reason was because too many people were all in that one space at a time because it was a nice day in Chicago.
Mm-hmm.
So when you go for walks, which is great, which I want to do today, is you can be by people that you already know. Maybe it's a time you could maybe go for a bike ride with your family member, but you want to make sure that you're not in physical contact with people who you're not living in the house with, and people you don't know from that end. So even if you think, okay, we'll just have them come over, but they'll still be 6 feet away, it doesn't, they introduce things to your house or to your environment that you really don't want. So it's not just social distancing, and that's why everybody says just stay home. Keep your butt home for at least, till we get through this crisis.
Yeah. Okay. Well, you know what? I think that's going to wrap up unless you have any final remarks on anything on your end there. I was going to do a closing.
I think you all think that you're young and invincible, but it does affect adults. It does affect kids. It can affect babies also. People you don't expect that get it could suddenly, get it and then be positive. Some people go through it just fine and recover, but there's about 20% or less that when they get hit because they have other, like asthma, or they have other symptoms, it really can take their toll. And truly, be smart and take care of yourself and be safe.
Well,
wash your hands.
There's a couple of comments from a couple of parents of my community, and they are saying, let's see, thank you so much for your efforts and your hard work. Please keep safe and healthy. Also, thank you for your efforts during this pandemic crisis. On behalf of me and Margaret Mead, Junior High, we appreciate all that you're doing, Mom, to help fight this. And
Okay.
There's no words. So thank you.
Okay, not a problem. I'm going to plan on taking a walk, take a nap, and take care.
Take care.